Welcome to my channel Medical Eyes. Today we are going to study pharmacology and our today's topics is respiratory system drugs. This is the part 1. Please subscribe to my channel Medical Eyes and stay tuned for the part 2. In this video we are going to learn about the drugs on cough. Cough is a protective reflex and it occurs due to stimulation of specific receptors like mechano or chemicoreceptors in throat and also respiratory passage or stretch receptors in the lungs. So the drugs for cough include pharyngeal demulcents, expectorants, and antitussives. Antitussives are cough center suppressant drugs. So this is the chart. We can see the drugs for cough which are classified as demulcents, expectorants, and adjuvant antitussives. Also the antitussives which are cough center suppressants. And the examples are given as follows. You can read and note the examples. And also the expectorants that are mucokinetics are classified as secretion enhancer drugs and mucolytics. And also the antitussives are classified into three groups such as opioids, non-opioids, and antihistamines. And in the last class, that is adjuvant antitussives, they are bronchodilators. We already know the bronchodilators. They are salbutamol and terbutaline. So firstly about pharyngeal demulcents. They soothe the throat. They can soothe the throat directly as well as by promoting salivation and also reduce afferent impulses from the inflamed or irritated pharyngeal mucosa, thus provide symptomatic relief in dry cough that arise from the throat. They include lozenges, cough drops, lintusses containing syrup, glycerin or licorice. So the next class is expectorants. Expectorants are drugs which increase bronchial secretion or reduce its viscosity, facilitating its removal by coughing. They are believed to loosen cough, which becomes less tiring and more productive. The drugs are classified as directly acting, reflex acting, and the last is mucolytics. The example are given below. You can note the examples. The directly acting contain sodium and potassium citrate or acetate, and the reflex acting includes chloride, that is ammonium chloride or carbonate, also the potassium iodide, and the mucolytis contains cysteine, that is acetylcysteine, carbocysteine, and also bromohexane. So the expectorants include the following drugs. The first is sodium and potassium citrate or acetate. It is believed to increase bronchial secretion by salt action. And the next is potassium iodide. It is secreted by bronchial glands and in this process it irritates them, increasing the volume of secretion. It is also a gastric irritant. It is dangerous in patients sensitive to iodine and interferes with thyroid function tests. Its prolonged use, that is if used for many months, can induce goiter and hypothyroidism. And in adolescents, acne may flare. It is nowadays not used on large scale because of these potential hazards. So the next type of expectorant is guaiacol. Guaiacol is mainly obtained from creosote wood and is also synthetically made. Guaiacol and its less irritating derivative, that is guaifenesin, are believed to directly increase bronchial secretion and also mucociliary action when after absorption from gut they are secreted by tracheobronchial gland. Also the adverse effects include gastric upset and also rash can occur. The next expectorants are tolu balsam, Vasaca syrup and terpene hydrate. They act the same way as guaiacol. The next class is ammonium salts. The ammonium salts are expectorants that are gastric irritants and also reflexly enhance bronchial secretion and sweating. Expectorant doses are some emetic but nauseating because of its unpleasant taste. So next we are going to study about mucolytics. The example of mucolytics first is bromohexane. It is a derivative of alkaloid vaccine obtained from Adhatoda vasica. It is potent mucolytic and mucokinetic and it is also capable of inducing thin copious bronchial secretion. It depolarizes mucopolysaccharides directly as well as by liberating lysosomal enzymes. Thereby, a network of fibers in tenacious sputum is broken. It is particularly useful when mucus plugs are present and its adverse effects are rhinorrhea and lacrimation, also gastric irritation and hypersensitivity. So the next examples of mucolytics are ambroxol, acetylcysteine and carbocysteine. Ambroxol is a metabolite of bromhexine having similar mucolytic action, uses and side effects. And the next is acetylcysteine. Acetylcysteine, it opens disulfide bonds in mucoproteins present in sputum, which makes it less viscid. The next is carbocysteine. It liquefies viscid sputum in the same way as acetylcysteine. And some patients of chronic bronchitis have been shown to benefit. The adverse effects include gastrointestinal irritation and rashes. So the next classification of the drugs for cough include antitussives. The types are opioids, non-opioids, and antihistamine. The opioids include drugs such as codeine, folcodeine, ethyl morphine, and morphine. And the non-opioids include noscapine, dextromethorphan, oxyladine, and clofenidiol. And antihistamines include uh, chlorpheniramine and diphenhydramine and promethazine. Antitussives, these are the drugs that act in the central nervous system to raise the threshold of cough center or act peripherally in the respiratory system in the respiratory tract to reduce tussle impulses or both these actions. And it should be only used for dry, unproductive cough or if cough is unduly tiring, disturbs sleep or is hazardous. These drugs aim to control rather than eliminate cough. So the next are opioids. The first example is codeine. It is an opium alkaloid and it is quantitatively similar to but less potent than morphine, and it is more selective for cough center and it is treated as the standard antitussive. It suppresses cough for about 6 hours and the antitussive action, it is blocked by naloxone, indicating that it is exerted through opioid receptors in the brain. And the abuse liability is low but present. Constipation is the chief drawback, and also the adverse effects include respiratory depression, drowsiness, and it is contraindicated in asthmatics and in patients with diminished respiratory reserve. So the other examples of antitussives, it is ethylmorphine and folcodeine. Ethylmorphine, it is closely related to codeine, which is methylmorphine, and has antitussive respiratory depressant properties like it, but it is believed to be less constipating. And the next drug is the folcodeine. It has practically no analgesic or addicting property, but is similar in efficacy as antitussive to codeine and is longer acting. So the second type, that is non-opioid antitussives. The first example is noscapine, that is narcotin. It is an opium alkaloid of the benzoisoquinoline series, which depresses the cough. It is nearly equipotent antitussive as codeine, especially useful in spasmodic cough. The adverse effect include headache and nausea. Uh, it is it can also release histamine and produce bronchoconstriction in asthmatics. The next drug is dextromethorphan. It is a synthetic central methyl D-aspartate receptor antagonist. The D isomer has antitussive action while the L isomer is analgesic. And the dextromethorphan does not depress mucociliary function of the airway mucosa and is practically devoid of constipating action. There are adverse effects like dizziness, nausea, drowsiness. At high doses, hallucinations and ataxia may occur. So the next antitussives are clofedianol. It is a centrally acting antitussive with weak antiasthmatic, anticholinergic, and local anesthetic properties. Onset of action is slow and duration is longer. And the side effects include dryness of mouth, vertigo, and irritability. The next drug is prenoxdiazine. It is a drug developed in Hungary which acts as antitussives by desensitizing the pulmonary stretch receptors. So the tussle impulses originating in the lungs are suppressed by these drugs. So prenoxdiazine is a peripherally acting drug. So the next class of drugs for cough are antihistamines. Many H1 antihistamines have been conventionally added to antitussives or expectorant formulations. They afford relief in cough due to their sedative and anticholinergic actions, but lack selectively for the cough center. They have no expectorant property, may even reduce secretions by anticholinergic action. The drugs include chlorpheniramine and diphenhydramine and promethazine, which are commonly used. So the next class of drugs used for cough are bronchodilators. Bronchospasm can induce or aggravate cough. Stimulation of pulmonary receptors can trigger both cough and bronchoconstriction, especially in individuals with bronchial hyperactivity. Hence, bronchodilators are used because they relieve cough in such individuals and improve the effectiveness of cough in clearing secretions by increasing surface velocity of airflow during the act of coughing. They should be only used when an element of bronchoconstriction is present and not on routine basis. There is another method used for cough. It is aromatic chest rub. Aromatic chest rub is widely advertised as a cough remedy, though it has been shown to reduce experimentally induced cough in healthy volunteers. There is no evidence of benefit in pathological cough.